Hey there, listeners. It's AZ with the Fire Rescue Wellness Podcast, and today you are listening to episode 134. I interviewed not one, but two guests. Alison Heartman, or Allie, and Anich are both physical therapists and strength coaches in California, and they are the in-house physical therapist for the Contra Costa Fire Department. And we talked a lot today about how they started their business, how they treat their patients, the wonderful, wonderful feedback that they're getting from the fire department, and so much more. So thanks for joining. As always, please share the podcast, give us a rating and a review, and have a great day.
Thank you for joining me on the Fire Rescue Wellness Podcast. I'm your host, AZ. I find the research and resources and then provide the fire service with the so what, now what, to ensure the health and well-being of every member of our profession. Together, let's thrive.
I actually wish I had hit record prior to Andy joining because that was some funny stuff. I have Andy and Allie, and I will introduce them or let them introduce themselves in a second. But Andy, can you tell us about your tech shortcomings?
No.
I sure can.
Look bad. Allie, about it.
Okay, Allie, just give us the brief synopsis of Andy's tech.
Well, I knew when I got this invite that it looked like it was going to be a different platform. And in the back of my head, I knew that I was going to get a phone call from Andy at some point around 8:01 when we should have been on already. And lo and behold, 8:01, and I get a phone call and I have to tell Annette to hold, please. I've got to walk Andy through the platform.
I mean, I did say that we could Zoom, so
yes, and that was like, what is he good at? I was like, FaceTime and like Zoom.
Google Meet. Good at Google Meet.
No, you're not good at Google Meet. That's the one that you couldn't get on.
Teams is the one I can't do. That's the one with NASA.
There you go.
And I got to figure that out before.
Gang, I have two guests today, and they are Allie first, because she was on first, shocker, and Andy. And so I'm going to kind of ask you both a couple questions. Is that okay?
Totally.
Great. We're ready.
All right, Allie, first question for you. Who is Allie?
So we have a little curveball for you, actually. We knew you were going to ask these questions. So we wrote intros for each other, and we don't know what the other person wrote. So actually, Andy, would you please answer this question for me?
Oh, shit. Okay, go.
Mine's not going to be that good. Okay, well, all right. Who is Allie? So in that picture, you go into a bar or some crowded social scene, and you keep hearing this loud cackling, and you don't know where it's coming from. But you want to find out where it's coming from because you want to hang out with that person. That's basically like Allie in a nutshell everywhere we go. So very social, but she balances it really well with professionalism when needed.
Okay.
So she's kind of a frat bro, I would say, like a 5 foot tall frat bro, which fits in really well in the firehouse.
Rude.
But also she likes Dungeons and Dragons, so it's again a weird balance there.
That is super. I like this that you guys did this. This is super enlightening. Okay, so who is Andy?
Great. Well, I have prepared an intro for Andy, and my intro is titled Andy, a 3-part reflection. Part 1. Things I'm better at in no particular order. In knowing these things, you'll know Andy. Number 1, I know how phones and computers work. Very appropriate for today. Number 2, I'm not scared of pants, either wearing them or shopping for them. 3A and 3B. My hands are bigger and my grip is stronger. 4, I don't need a silky black eye mask to take naps. Moving on to part 2.
Wow.
Part 2. Things that make Andy a uniquely capable physical therapist and advocate for fire, rescue, health, and wellness. 1, Andy has an uncanny ability to make connections with people. Like when I showed up to TSAC a day late and he'd already made friends with every single Canadian at the conference. Shout out to Regina, the city that rhymes with fun.
Wait, stop.
Yeah.
There's only one person that says that, and that's Dr. Joel Krentz. Do you know Joel?
No, it's the actual slogan from Regina, Canada. And we met a bunch of people from Regina, and they had a shirt that said "The city that rhymes with fun." And they were going to give me the shirt, but then I ended up not seeing them before we left.
Oh, I thought that was a Joel Krentz original. Okay, yeah, because everyone says Regina.
They said it's pronounced Regina.
It is Regina. That's correct. Oh my God. Okay, continue, Allie.
I only have a couple more points.
Oh, jeez.
Number 2. Andy is passionate about his profession. I'm constantly impressed with his ability to make complex ideas into thoughtful and digestible messages. As an educator, he's always asking me, how can we do this better and more effectively? That one's just nice. No jokes.
Okay.
And then part 3, he loves aliens. Look at his shirt right now. That's all.
All right. I got to take a screenshot. Everyone smile. Okay. I feel like that was so accurate. First of all, let's back up a little bit. I feel like Andy, at such point that you would ever be saying wedding vow, because you're not married, right, Andy?
No.
At such point you would ever be saying wedding vows, I believe you would be the person that's not prepared.
Correct.
I don't do. Okay. Allie missed the point where I don't do emotional stuff. So yeah, I would.
Oh my God. You guys are too much. Okay, did you prepare answers to the other questions?
We did, but individually and probably not with as much enthusiasm.
Okay, well, let me ask then. Allie, I'm going to ask you then, what sets your soul on fire?
So I get activated by live music and watching other people succeed.
Okay, Andy. Andy's busy drinking a protein shake. What sets your soul on fire?
If we're going with music, Blink-182. Any Blink-182 song it gets me going for sure. But realistically, in the professional career, it was always when you go into the PT school, you have your vision of what it's supposed to be. And when I graduated in 2018, I was pretty frustrated with all the passive modalities and everything like that. So it was always a drive to find who's doing it right, who's doing it more progressive. And then from there, it turned into I wanted to go into sports performance, sports medicine. And from there, it turned into, okay, they have everything they need already. I can make an impact, but there's already people doing that. And then that's when I went towards fire. And that's when I hit this point where everything I'm doing is very clear, the direction I'm going. So I would say finding where there's need and bringing a more progressive side of sports medicine into it.
I like it. Allie, how are you changing the world?
I think it goes back to what my last answer was, where I really just love watching people excel and build on their goals. And as a physical therapist and kind of the profession that we've found ourselves in, I feel like my path is to help people find those successes.
Love it. Andy, I can't wait for the answer to this question. How are you changing the world?
Oh, okay. I didn't know it was supposed to be such an exciting answer. No, I mean, it plays off of the last one. Like, I think I'm speaking for Allie and I when we're trying to get what's in the professional sports world into the fire world. I don't necessarily think I'll change the world, but when we go to Mars, I'll change that world.
Oh my God, you are an alien, dude. Okay. We'll get into that.
You asked for it.
I did ask for it. Okay, I'll be a good host. Sometimes I'm not, but I will direct the question to the person. And then if the other person wants to chime in too. But Allie, I want to know your origin story. How did the two of you meet? How did you start your performance company? The mic is yours.
So Andy and I used to work at a sports medicine clinic in Sacramento together. And we, through a series of events, it was a pretty high-end, high-level sports med clinic. So we had, like squat racks, and it was in a baseball training facility. So it was a giant turf. It wasn't like small PT rooms. So we ended up getting a lot of workers' comp, fire rescue, military, police, obviously sports too. But Andy and I would just chat back and forth about the different injuries that we were seeing specifically for fire rescue. And we were like, man, if we could just like get in there, I feel like none of these injuries would have happened. That back surgery probably didn't really need to happen. That shoulder thing probably didn't really need to happen. And so we just were brainstorming it. And then Andy ended up chatting with one of the firefighters who got in touch with the battalion chief. And one thing led to another. And Andy actually started off going by himself one day a week into Contra Costa County fire. And pretty quickly it took off. So our plan was always that I would come and join. And within, I think like a month or two, he was so busy that he couldn't even see the amount of people that were coming through. And I ended up joining him. And then it's just expanded from there.
You had me at Andy was talking to someone, because that's like, we were just together at Science of the Station and Andy knew everyone.
Yeah, I know. That's I think Andy and I do a really good job of balancing this business out. One of Andy's, and I did have it in my intro, but one of his like really impressive skills is anywhere he goes, he just makes connections. And I know you've said before, like networking isn't really the right term. And I totally agree. Cause like what he does isn't networking from a business standpoint. It's just like making friends and then doors open. So that's one of the things that I think has made us as a company really excel.
So Andy, I want to bounce this one to you because you were the first one to just, it sounds like one day a week you were going in there. How did you get things rolling? How did you get the firefighters to trust you and start seeing them?
It's kind of a funny story. So it's a lot of luck, it's a lot of timing, and it's a lot of getting the right person through the door first. Um, so initially, the reason I got brought on is I think it was because a lot of people try to get into the fire world through like business moves and like, hey, we can come assess everyone and create individualized programs. And mine was more like the people I was friends with in the fire department are saying, hey, why don't you come here and just do what you're doing there? We'll get it set up. And then they told everyone at the department, hey, he's going to be here Wednesday, go see him. And I think where it really changed was day one of the guys through the door was a really respected captain. And he came in with a shoulder injury saying, and I clearly remember this, but he's saying, hey, this has been bugging me for 3 weeks. I haven't even been sleeping on my 4 days at home. All I can think about is what am I going to do? Somebody I know has surgery for the same thing. I can't be off 6 months. I can't miss work. And so it was just this spiral that led to the injury not healing, the injury getting worse. And it was this very, very easy, just like bicep tendon type of thing. So I laid him on the table. I was like, all right, let me just do this. And I worked on it for 10 minutes, gave him 2 exercises. It cleared up pretty quickly on the table. And he called me next week and he's like, dude, it's totally gone. And so he told everybody at the department, go see him, go see him, go see him. And it got to the point where I had to see people every 10 minutes because it was so full. So that's when it was a really easy sell to the department to say, hey, can we just bring somebody else on? And so now we can get through all 3 or 4 people on that rig in an hour efficiently instead of in an hour and they don't get what they need out of it.
Okay, riff on that a little bit more because this is not what I was picturing how it worked. So tell me, how does it work? I'm a firefighter there. I want to see you. How does it work?
Okay, so yeah, this is something we struggled to get across for a while until somebody that we were interviewing to bring on gave us a good analogy. But it's literally like a training room in any kind of pro, college, high school level. So we're in a gym, whether it's attached to the station, whether it's just like in the department. And people come through off duty, on duty, whatever. They'll contact their BC and say, hey, can we bring the rig through? And you'll have 2 or 3 rigs coming through at a time. You'll have people off duty coming through and they're working out, they're bullshitting, or they're waiting in line to see you. And so it's just this room full of firefighters having a good time and like either decompressing before they go home or just hanging out and then getting worked on when there's time. Sometimes you can't get to everyone, which is a little bit of a bummer, but we have a pretty good system now where we can usually, if we're there for 5 hours, we can usually turn out anywhere from 8 to 16 people with with 2 of us there for, yeah. And you can see somebody for 10 minutes. You can see somebody for 2 hours for 4 injuries, whatever you want to do. And Allie, I don't know if you have anything to add to how to explain it.
Yeah, I think that initially when people hear that, it's like we don't exactly have a schedule and people kind of just come in when they can. It sounds like it would be a little chaotic, but that's why we've really emphasized having 2 PTs there at a time so that we can get people through. And we found that if we did hold people to a schedule, then when people did have time, like say all of a sudden, they got off shift and they're like, okay, actually, I do have 30 minutes to come in. I'm going to go try to get in. If they don't have an appointment, then they're just not going to stop by and we're not going to see them. But if we don't have a schedule, we have kind of this like loose drop-in policy, then it's just one less level of resistance to get people to come through. So we found that we actually see quite a bit more firefighters coming through because we don't have that schedule. So it sounds like it would be chaotic, but it works out pretty well. And people understand when they come in, they might need to wait 30 minutes or whatever.
And I feel like that captain with the bicep tendonitis would have at some point when someone else was coming in for something, it would have occurred to him, oh, hey, I have this thing, and he could have been treated far earlier. I would imagine, right?
Yeah. I mean, that was the first day I was at the department really, but realistically now what happens is, if you treat somebody's shoulder, then they're telling somebody else who they run into that says, oh, my shoulder's bugging me. They say, just go see Andy and Allie. It's super easy.
Okay. So Andy, I want you to tell me in the detail that a fire department would need, not the detail a PT would need, in the detail a fire department would need, what is the logistics in terms of, do they need a diagnosis? Do they need a certain number of treatments and they have to get sent out? Like what for a doctor's visit? How does it all work?
What exactly do you mean by that?
Okay, so
can I jump in and answer this
question?
Absolutely.
Yeah, absolutely.
So because you're essentially talking about like logistically, legally, that kind of thing.
Yes.
Oh, okay.
Yeah, okay. So in California, we are a direct access state. So we are allowed to treat injuries without a doctor's referral for a certain amount of visits, a certain amount of time, right? So someone comes in and they have a shoulder injury. We chart it as a shoulder injury. Eventually, it just becomes like a strength and conditioning thing. And it's not in a way to like get around the rules. It's just legitimately like our treatment style usually leans into strength and conditioning anyways. So if it turns into something that we think needs some more medical intervention, then we will refer them out to other providers. And if it seems like we're definitely not trying to encourage people not to make workers' comp claims or things like that. Like we want them to protect themselves. So a lot of times we'll be like, yeah, go make a workers' comp claim. We'll work on it in the meantime. And then if you feel like you need if you need to go to a MD, get some imaging, whatever, it's already set in place.
Okay, so perfect.
Yeah. And then from a workers' comp standpoint, we're not contracted with workers' comp. So they have to go through the workers' comp system with other providers. And we tend to refer out to like PT clinics that we know and we like, and we know they do a good job. And then we'll essentially like supplement their treatment plans with things that we know are more related to rehab for fire rescue.
Perfect. And Andy, I'm going to bounce this one back to you. I've had a couple other PTs on and they have always the same philosophy as you do, because that's the best philosophy. We don't get better on the table. Strength and conditioning is the key, so on and so forth. But can you reiterate for the listeners that philosophy? Because I think so many people assume they need to go to PT for ice and stim and like all these passive modalities. And I need them to hear this message again from more PTs.
Yeah. I think there's a time and a place for passive modalities, right? If there's something that's really acute, something just blew up on you, you can't move it, you can't touch it without pain in some aspect, then it's time for some kind of passive modality that's just going to make it feel better. But the reality is the job is really physical. And if you're not loading the tissue to the capacity that it needs for the job, right? If you're going up and down on and off the rig with the turnouts on, if you're on the truck and you're using any of the heavy equipment, you need to lift that heavy before you go back to work. And so the only reason you're going to make a change in the tissue that's going to help with the job is to load it heavy. So there is a good time for passive modality, and that's usually at the beginning of a treatment if there's a pain pattern that you need to stop, right? If every time you go up overhead with your arm and it hurts in the front of your shoulder, then maybe some ART, some cupping, something that's going to reduce the tension of the anterior line of the shoulder to help you get up overhead. And once you can do that pain-free, then load it. That's usually where we find more success. But we don't do as much, I would say, manual or stretching as maybe the general clinic, but we do find a good use for it. Probably, I mean, we want to make people feel better in the moment, so we use it a lot. But it's not what we end with. We always end with some kind of strength and conditioning thing that is compatible to what they need to do on the job.
Stay on that topic for a second. I know terminology is different in different states, but what I'm familiar with is work hardening. So you've been released from physical therapy and now you go into work hardening. And usually it's inadequate because it's, kind of the same thing for everyone. Here's a milk crate with 15 pounds in it, put it down, up and down and up and down. Do you have a sort of work hardening program, or is that baked into the treatment plan? Did that make sense?
Yeah, totally. Yeah, it's definitely baked into the treatment plan. We have some pretty specific things we try to hit with everyone as far as types of exercises. So we try to hit single arm, single leg stuff, right? Because you're never really in a bilateral stance. You're never really loading both sides of your arms the same when you're working, right? You either have some piece of equipment on one side, or it's heavier in one hand than the other, or you're picking somebody up in a weird position. So we try to hit a lot of single arm, single leg in their program. We try to hit a lot of lateral line. So working on like the glute, the quad, the oblique, that side, in like a side plank in like a single leg pattern. We try to do a lot of pulls instead of pushes. So like 2 pulls to every push to build up the back line, to build up the postural muscles, to prevent getting too much anterior tension of the shoulder. That's baked into everyone's routine. But the way we implement it is usually we ask them what they're already doing. And we just show them, hey, your lifting routine that you're already doing, instead of doing barbell press for this, do a single arm press, do a single arm pull, get into a split stance for your squat instead of the bilateral stance. So we try to make it low barrier, easy to implement, and really, really works to complement everything they're going to do on the job, which is what the whole point of work hardening is, right? It's does the exercise you're doing, does it help you get better at your job? So we just bake it in to their program already.
Bake it right in. I love it. Allie, tell me about program delivery, because this is always a question that departments want to know about. Like, is there an app? Is there like a website? Do you write it down on a piece of paper? Is it YouTube? How do you deliver your programs to your patients?
Yeah, that's a good question. And I think it's something that we're constantly building on. Currently, what our process is we will have, and I'm talking about individual programming right now, but we'll have someone come in, we'll find out what kind of programming they want. Do they want it to be a weight loss thing? Do they want it to be a bulking thing? Do they have a history of back pain? We'll get some more information from them. And a lot of it is like also realistically, how much time do you have? Do you want to do 2 days a week? Because some people only have time for 2 days a week, or do you really have time for more like 5? And then we'll do some assessments, see what they need. And then usually we will build out a program on a spreadsheet and then send it to them a few weeks, a few weeks at a time, and then get some feedback on how it went. We have a video library of exercises that we include in that programming to emphasize form, and some of the things that we do are a little bit more corrective from like a warm-up standpoint. So because those are so specific, we want people to have a reminder of how those look. Ultimately, we would love if we could have an app, and we have been kind of like brainstorming some different ways that we could do that and somehow include recovery as a component of that. Because we know that, I may give someone a program and tell them, okay, today you're going to like do max deadlifting or whatever. But if they're not recovered, then that's probably not really the appropriate day. So we are brainstorming ways that we can incorporate recovery scores into that programming as well to modify it along the way. But that's like our more like long-term goal. Currently, it's pretty basic with our video library and then our spreadsheets.
Andy, I'm going to bounce this back to you, and I probably should have asked it before, but can you talk about the size and the how far the stations are apart? How many stations are there? How many members at Contra Costa?
Yeah.
And how many days?
Okay, so at Contra Costa, it's funny because everyone you ask will give you different different number because of how much growth they've had. So when we initially started, I want to say there was maybe 26 stations, and I think they're up to 34 just 4 years later. So there's a few annexations. There's been 5 academies with 20 to 30 people, and it's just they're constantly growing. So I would say there are about 36 stations right now, 34 to 36, and a few other smaller departments that utilize some of the resources too. But there is, from the west side to the east, is probably like an hour and a half drive, I would say. And I think I looked it up and it was 55 miles or something like that. So it's big. There's battalion 1, 2, 7, 8, and 9. So there's 5 different battalions in it, and yeah, we are there Tuesday, Wednesday, Thursday. There's 2 of us in the central part of the county on Tuesday. There's 1 of us in the western part on Wednesdays, and that was newly added because we were just based off of the numbers we were gathering, we weren't getting Battalion 7 out there at all because they're just too far off on their own. And then Thursday, there's 2 of us on the east side. So we just try to hit a different area, all the areas each week, basically.
So can you talk about, and generalities it's fine. Generalities is absolutely fine. Allie, can you talk about, I actually hate to ask this question, but fire departments want to know. Can you talk about return on investment if you have any perspective on that?
Yeah. So in the beginning, when we first started with Contra Costa, we leaned onto South Metro quite a bit because they had gathered information on return to work using internal physical therapy versus external physical therapy. So we used some of their data for that just based off of visit number. And then we also did we essentially, without going into too much detail because it's kind of a complicated algorithm, and I'm happy to share this information with anyone who's trying to create some sort of ROI within their own department. But we essentially created an algorithm which leaned into how many new cases we were seeing and then based it off the overtime of a entry-level firefighter and created a cost savings compared to how much they were paying us for our services. And our ROI quarterly fluctuates anywhere between like 5 to 1 to like 3 to 1 kind of a thing, like being super conservative. It was much higher when we very first started, but we were just getting slammed and weren't creating an effective product. So I think that was like a little bit of a misrepresentation of what we wanted to do. But the ROI that we have has remained pretty good since we've been there. Interestingly, though, when we went to present to our department about fiscal savings, they were happy to see that it was fiscal savings. But what they wanted to talk about more was the quality of the program and what the firefighters were getting out of it. Because we also, through this time, have maybe like once a year, twice a year, we'll send out surveys. And the feedback that we're getting from people that initially we didn't really expect was that it's become a more of like a mental health benefit for them than, obviously there's a physical benefit as well, but just having healthcare providers on site that they know, that they trust, that they can get to easily without going through the rigmarole of workers' comp and whatnot, has made it so that they don't have to stress about getting hurt, or if they are hurt, they don't have to think about like, oh, do I have to take time off? Like, what do I got to do here? So the ROI, because I think it is super important because fire departments want to know about it, but also figuring out a way to capture the quality of the program and the actual like person to person impact that it has ends up having a pretty bold effect when you're presenting to departments, trying to get into departments, trying to just support your program that you've already created.
From a consumer standpoint, I hear that loud and clear. Mm-hmm. And I have a few physical therapists, I think, that listen. I want y'all to hear that loud and clear too. You need to ask for testimonials. So not just physical therapists, dietitians that come in and do whatever education, ask for testimonials because they're important. It matters. It creates an impact. Love it.
Yeah, I want to just like reemphasize that the personal stories that people gave us and we wrote down, and we have like a document that we track and we say, hey, can we share this with people? Those have been so effective when we've talked to other departments about what we do, because it puts real lives and real injuries and things that those people that you're talking to, they can relate to. And it makes a huge impact in the conversations that you have.
Yeah, 100%. From a business standpoint, that's genius. And I'm going to switch. I'm going to do like a huge switch. So I want to make sure that you guys have completely shared everything you want to share regarding the business part of it. Andy, do you have anything else regarding the business part of it?
I mean, when Allie mentioned the budget meeting we had like early on, the coolest thing that I think, in my opinion, that we heard was the fire chief. He was like, it doesn't really matter if you can prove monetarily or not, and this is going to be different department to department, but he's like, I don't care really how much the program's saving, but he's like, good news travels fast, bad news travels way faster, and I have not heard a bad thing about the program, and the usage is very high, so we absolutely are going to keep it. That was a cool thing to hear, where it's just like, okay, that probably is true. There's no like bad gossip being said about us, so hopefully we're delivering on a good level. But from the business side, I think like to fit the culture, it's a very casual thing, right? It's not, and I think that's what the way that I play it a lot of the times is just like it's building relationships. I'm not going to Science to the Station thinking like, oh, I wonder how many contracts I could get here. It's more like, this is my passion, this is what I want to do, and there's other people doing the same thing. So build the relationships and see where it goes.
100%. Allie, anything else on the business side of it?
Yeah, I mean, I think that Andy and I have the same mentality in this. It's what's been really great about working in fire rescue community, more so than in the sports med community that we were in before, is that people genuinely want to just help each other. Like, I can't describe how many times we've reached out to other departments that are doing something cool and they just give us all their information. They're not trying to protect anything. They just want other departments to be doing a good job too. So from a business standpoint, I think that it's made what we're trying to accomplish feel easier, and just like we're part of a bigger team. It's not just us. Like the whole country is trying to do this too. So it's been nice transitioning into fire for that reason.
It's so funny you said that, because I had this conversation with this week's guest, and I believe with a lot, like 4 guests in a row have said the same thing. Like, there's no gatekeeping in tactical. In research, like, holy heck, research outside of tactical, holy heck, there's gatekeeping. Well, speaking of previous episodes, Andy, I don't know if you heard this past episode with Dr. Jenna Yentis. Did you hear it? We talked about you.
Yeah, I did listen. Yeah, whatever.
I was cracking up. He was like, oh, you should listen to the episode with Jenna, because we're going to have a meeting with NASA later today. And I was just dying laughing because you guys were like, Andy's so great. Andy. And I was like, oh, Andy, did you want me to listen to this just because they love you so much?
No. I wanted Allie to hear what she had to say on tennis elbow. Which is what the question that's coming.
The question that's coming. Okay, so Andy and I were walking around, the Leaves with Lieb at Science the Station and talking about elbows. Okay, so let's back it up. Listeners know this. Andy and Allie know this. Probably the general population knows this. The 3 injuries we see the most often in fire: low back, knee, and shoulder. But also, there's this huge, can we call it it feels like an epidemic of elbow injuries. And Andy has a theory, and I want to have him share it with the world. Andy, go. The mic's yours.
Okay, well, I would say my theory keeps changing, and it's developing, and it's not as good as I want it to be. But going back to what you said about the common injuries, I think this is a point that Allie and I wanted to make. In the literature, it's shoulder, it's knee, and it's low back. All of those numbers are generally based off of what takes people out of work, what puts them onto workers' comp. When you're actually embedded in a department, what you start to see is a lot more shoulders than back and knee. Like shoulder becomes the most common thing, followed by elbow. And it's a lot of upper extremity stuff. But that stuff's not generally taking people out of work, so it doesn't get put in the literature. So I think that surprised us is like, whoa, there's a ton of tennis elbow. So we've spent years trying to decide, okay, why do we think it is? How do we assess for it? All that stuff. And in general, if in the office position as an office worker, it's generally a weakness, right? It's not strong enough. It needs to be stronger for the positions it's in. But what we see here is you can't really test grip strength and get a correlation because your dominant hand is going to be stronger, but it's also the one that's developing tennis elbow more often because it's an overuse thing. So you can't really test it in that way. We tried to test with endurance with like a dead hang with like a high repetition, extension, or rotation. And it's just not showing us anything. And it just seems to be like the stronger your bicep or your forearm is, then the more work you can do, and you still develop it because you're doing more work. So we haven't come super far. And anyone listening, if you have ideas, please reach out. We're happy to talk about it and hear what you have to say. But going off of what Jenna said, then, and she nailed it too. It seems to be like a lot of the engineers get it when they promote and they start doing a lot more intricate work with the hand itself. And so that's where it can come to play. Like maybe it's something to do with the glove fit. There's just a little too much space in the end of the fingertips or anything. You have to work so much harder to get that dexterity. So we don't have like an excellent theory, but what we do have is a nice way to start treating it once it develops. So a lot of people in our department know, hey, come to us as soon as you start to feel it, because the more chronic it becomes, the more of an issue it is. But the way that we go about treating it, and this is important to hear, and this goes for any tendon really, is number one, you have to take out some of the tension. So if you take out tension in the muscle, it's going to have less pull at the tendon at the site of attachment. So just a lot of time where we just teach people how to do it on their own, right? Like put deep pressure into the muscle, move it around, do some self ART. Consistency with that, followed by step 2, which is a lot of blood flow, right? If you have a tendon issue and you let it sit, it's not really going to get blood flow. It's not going to heal that well. You have to get it to this point where you feel it like 1 or 2 out of 10 with some kind of discomfort. And if you hold it for 15 to 30 seconds and just get consistent blood flow, it's going to start to bring the nutrients in to heal it. And then step 3 is continue everything you're doing, but try to modify to stay in that 1 to 2 out of 10 pain that gets better with every set. So if you want to do bicep curls still, you might have to drop the weight a little bit, but just slow the tempo down. If you slow it down, if you slow down your pulling, if you slow down all that stuff, you get to the point where you're like, oh yeah, I feel it, but it gets better with every set. And that's when you start to develop the strength and improve the resilience of the tendon without picking the scab and pissing off that injury. So our treatment style is getting better. We're finding more stuff with that. The assessments, we're still trying to figure out how we can predict it. Allie, do you have stuff to add to that?
Yeah, I think the other thing that we do well is we set an expectation for tissue healing timelines, because the problem with tendon injuries is that they take a long time to recover, and being consistent with the exercises and the tissue release and things like that is important. But when you're not noticing huge changes immediately, it's hard to stay motivated. And what we've found is that tissue healing timelines for firefighters are even longer than the general population because...
Why, Allie?
Well, let me tell you, they're not sleeping. They can't get
louder.
A break. Yeah. So it's just giving people like a realistic expectation of like, okay, tendon healing is like 3-ish months if you're doing all the right things. You guys are doing like 20% of the right things and 80% of things that are counting against you. So realistically, this is probably going to take closer to like 4, 5, 6 months to heal. And as long as it's going in the right direction, you're doing the right things. You're going to have some good days, some bad days, but as long as the overall trajectory is up, you're good. Stick with it. You're on the right path. It doesn't mean that you're not doing the right stuff. So just creating like a realistic expectation for people has also been really helpful.
Andy, I can't remember if we talked about this, but I think we did. So the knee injuries can sometimes be attributed back to lack of mobility in hip and ankle, right?
Right.
So is it same with elbow, kind of like the elbow is the slave of the shoulder and the wrist? Could we preemptively like, okay, so this is my wrist mobility. So me doing push-ups probably isn't the greatest exercise because I don't own the range of motion. Can we preemptively do anything about those little elbow son of a bitches?
Yeah, I mean, yeah, it's one of the main things or one of the big concepts in physical therapy is the joint by joint method, which is every other joint should be relatively stable. Every other joint should be relatively mobile. And if the mobile one's not moving well, then the more stable one has to move extra to make up for it. There is a correlation between something starting as a neck or shoulder issue that leads down to the elbow because you're not manipulating your shoulder as much and you start to use the elbow more to do that. So yeah, if you have some kind of shoulder thing that's starting to flare up, you need to take care of that because if you let that ride out, then that's when the elbow can start to flare up too. And from the wrist standpoint, yeah, lack of mobility in the wrist could also lead to excess motion, excess use of the forearm.
Yeah, and generally we'll incorporate grip exercises, which isn't related to what you were exactly saying about mobility, but is more getting about like the stability of the joint down the chain a little bit. And we'll definitely incorporate like shoulder stability things because it is pretty common that someone will say, oh, I had this elbow thing. I also hurt my shoulder a couple years ago. And since then it's kind of never been the same. So yeah, absolutely. Including those in the overall thought process is important.
Andy, I want to go back to something you said because it blows people away. So back to the, like, this has been hurting me and now I'm afraid. And, you know, the catastrophizing. Did I say it right?
Catastrophizing?
Yeah, that.
Yeah.
Say it again.
Catastrophizing.
Yeah, that.
I was like, I don't even know that word, so okay.
Listen, you don't know how to operate your phone or your computer or either, so it's fine. But that's the message that I've been trying so hard, at least one-on-one to the firefighters. Like, we don't go to worst case scenario handbook first. We make the assumption that it's something that we can, I won't say easily, but it's something we can work on and we don't have to live with it. But how can you amplify that message? Make it louder, Andy. Say it now.
Which message? Sorry, cut out a little bit.
Oh my God, Andy,
I'm trying so hard with the phone stuff. The message of like the message of you need help with with an injury if it's starting to flare up or what? I totally missed it.
No, the message. No, you're fine. The message that, because I don't know if it's just firefighters or humans, we always go to worst case scenario.
Oh yeah.
Like,
okay.
Oh my God, I woke up this morning and I can't move my shoulder. Oh my God, I'm going to have surgery. Like, they miss the whole like middle part. They get to the bad stuff. How do we amplify the message of let's not go to the bad stuff immediately?
Yeah, I mean, when people come to us, the thing I think that helps a lot with that mental health side of it is having a plan and having a starting point and knowing the timeline of whatever you're dealing with and knowing the steps to get there, right? Whether it's you're missing motion, so you have to get motion first before you load the tissue. Whether you're still in pain and you have to get out of the pain cycle, and knowing that the pain cycle is generally like 3 to 7 days with some sort of flare up. So knowing the steps where it goes from pain to mobility to loading the tissue, and knowing the timeline where muscle bone generally takes 4 to 6 to 8 weeks to heal on its own, tendons generally like 12 to 14, and yeah, it takes longer because it's not as good a blood flow. So knowing that, knowing the timelines, knowing what to expect out of it, I think helps a lot from not going straight to worst case scenario, but also having an advocate on your side or somebody at your department that you can call or email as soon as something happens. That's been a big help for that as well. But yeah, it's not everything that happens is worst case scenario, and usually none of it.
Yeah. Managing expectations. Allie, I feel like you had something to add to that.
No, I was just happy that you asked that question because I feel like that's something that Andy and I talk about a lot. Is most people, and this isn't just firefighters, I would say this is a lot of general population, come in and I'm not exactly sure why like surgery is everybody's like number one thing that they want to jump to. And I don't know if it's just they haven't had experience with physical therapy in a way that's like really brought them out of an injury. And it's kind of like the only option that they know. But it is pretty, people come in and they're really anxious and they're like anticipating all this, like, oh, I'm going to have to go to the doctor. I'm going to have to get imaging. I'm going to have to do this. I'm going to have to do that. And what Andy was saying is exactly right, is like just kind of education is huge in that circumstance. And also being able to make like a little bit of progress in the moment. Like Andy used the shoulder example of like someone who presses overhead every time it hurts. If you can get it to feel a little better in the moment and show them where their deficits are, like maybe that shoulder's not quite as stable, but that's something that physiologically you can very much work on, then people kind of like understand the process more. And you can see them like take a deep breath and like, okay, this is going to be okay. I understand what's going to happen here. So yeah, I think that it's important to do so.
Hope is a very powerful tool.
Yeah.
There we go. All right, Andy, we're going to start wrapping up. So I would like to hear, I know, wah, wah, wah. I would like to hear either some sage advice, some summary, something you would want to leave the listeners with, and then we'll, of course, talk about dogs. But first, the education part.
Okay, so I think what we learned is coming from sports performance to fire, we thought like, okay, it's going to be pretty similar. A few of the things that we learned early on is one of them in the way that we run it as a training room. Sometimes you only have one touch point with the person in like 3 months or 6 months because the department's big and they come in, they're with their crew. They're like, yeah, the shoulder thing's bugging me. And you have 30 minutes and you don't see them again for 6 months. So being able to be efficient and make a plan, but the way that the plan has to work is that it has to be super logical. You have to give a purpose for everything they're doing and explain exactly why it relates to their injury and to what they're trying to get done. You have to make it so there's no barriers as far as a time constraint, as far as equipment they don't have, anything like that. And it can't really take up any time. So it seems funky and it seems really complicated, but really you're just having the conversation with people of, okay, what do you do now? What do you like to do? What's your exercise like? What's your routine like? And if they tell you their routine of their normal push, pull, squat, whatever routine they're doing, or they don't have one, it's really easy to say, all right, these are the 2 things that are going to help you. We just did them. You felt how it helped. So you know that it's going to help you. Here's where you implement it into your workout without changing anything, without adding time, without doing any of that. So that's a long-winded way of saying the programming to be culturally competent and fit what people are looking for it has to be so simple, and it has to fit in with what they're already doing, and you have to show them that it will help them. So I think that's a big thing we learned to get buy-in, where we don't really run into people coming back saying, oh, I haven't been doing what you taught me.
And so the message inside the message that I want you all to hear is that 3 times a week for an hour for 12 to 16 weeks going to physical therapy is a business model. It is not a way to get people better.
Well said.
I stole that. I don't know who I stole it from, but I stole it. Oh, I know who exactly I stole it from. Shante Cofield, the movement maestro. Okay, Allie, I would like some of your sage advice, summary, or sparkles to leave the listeners with.
Yeah, because I think this conversation is kind of twofold, right? It's like, how do you treat an individual firefighter? And it's how do you implement this kind of program into your own department? And what our advice is to other departments that have approached us is always keep it simple, keep it small. When we started, there was 2 of us. We were there 1 day a week. We gathered a lot of data, a lot of injury usage data, a lot of what I was saying before of like quality, like how it's actually affecting people. And then we created some sort of cost savings that then we were able to lean into when we wanted to expand the program. But going in and expecting to start with, a PT 5 days a week, and then we're also going to get mental health, we're also getting nutrition, like it just, departments have a hard time biting off that number right away. So starting something that you can get buy-in pretty easily, we're a little biased. We think physical therapy is a good way to start, but it could be something else, is just knowing that if you can just get your foot in the door in health and wellness and prove the concept there, then you can expand on top of it and it can be a multi-phase thing. But just keep it simple, keep it small, make it happen, and then you can build into these like bigger, loftier goals.
And from a business standpoint, more people in the space, in my opinion, is better because it is providing proof of concept. It only opens up more opportunities. I love that.
Yeah.
I'm going to stay with you, Allie. Please don't disappoint me. Do you have a dog?
I sure do. I actually had to drop my dog off at my brother's house because she's very barky. So for recording this, she's having a little bit of vacation right now. But yes, I have a dog. She's good.
Tell me about the dog. Give me all the details.
Her name is Jojo. She is a German Shepherd Lab mix. She's all white, pointy ears. She's very cute.
I love it. And how old is Jojo?
She's 5.
Okay. Andy, do not disappoint me.
What?
Do you have a dog or not?
I do not.
Oh, okay. Full disclosure, neither do I.
Oh, really?
No,
I thought you did.
I don't have a dog. But what were you going to say?
I said I go to Allie's house when I need a dog.
Okay.
Jojo.
You get your dog fixed there. Jojo.
We also, actually, at the fire department, we got 2 therapy dogs within the last month. So we'll go into some of the stations and there'll be a dog there.
Okay. All right. You've just redeemed yourself. You'll redeem yourself even more if you text me a picture of said dogs. Yeah. So Allie and Andy both text me pictures.
I got the therapy dogs. I got my dogs. I got all the dogs.
You should send her,
all right.
Send her the video of Bonus doing the workout, the squats and the push-ups.
I have a whole folder of, so one of our rescue dogs, one of the firefighters brought him in for PT and he showed us his workout routine, the dog's workout routine. And so I have a whole folder of videos of the workout routine of a rescue dog.
He won the peanut butter plank contest.
Yeah.
7-minute peanut butter plank.
Okay, I'm going to need a lot more details about all of this. Well, guys, I am so happy that, first of all, I'm happy that you guys had time. And second of all, I'm happy that Allie was able to tech support Andy to get him.
That's why I'm here.
Lined up.
It worked. Yeah. It worked.
Well, it worked. All right. Well, we're going to drop the mic. AZ, Allie, Andy, the A's. We're going to drop the mic. Are you guys ready?
Ready.
All right. Drop it. Have a great day, you guys.
All right. You too.
Thank you.
Thank you.